of the following year.
Welcome to the research proposal presentation for the health system course this quarter. So we just have very few simple rules. One is that you have a maximum of 5 minutes for your presentation, and you can use at most 5 slides for the presentation also. So that if you exceed 5 minutes, then you'll be prompted to finish to wrap up your presentation, or otherwise you'll be cut off from the presentation, so that it will be able to give time for the others to share their proposals. So given the time limitation, make sure that you're aware of the time, and I'll be doing that timer countdown. And since you have already discussed among yourself who will be presenting in order, so you just present in sequence based on the order that has been agreed upon by your group. And I will reserve the questions for each presentation after everybody has presented already. Okay, so I hope that's clear. So based on what I see on the chat, we will have the following sequence for the research presentation, our research proposal presentation. First will be TJ, then Ufong, Lawas, Baluso, Paket, Ilya, Basqueta, Sondagi, Abayon, Baldos, Paugan, Lucena, Bulia, Pugong, Julio, Palangdusan, Lumenyo, Kial, Duco, Calabia, and then Impila. Okay. So, TJ, are you ready to start?
Si Kim po yung una, Doc. Latigo po.
Tama. Latigo pala. Okay, sorry. I thought it was... All right. So, Kim Latigo. Kim?
Started with that. So, karamihan naman po ng students really serve in the community. In fact, we have the highest retention rate, about 98% in all of UP. Pero dahil nga po sa babago yung mga panahon, kailangan isigurado. So, naging legal document na siya. And this has been...
Good afternoon po, Doc and classmates. This is Kim Latigo, and I will be presenting my research proposal with the title Level of Financial Literacy and its Impact to the Well-Being of Medical Students Attending Medical Schools in Leyte. So for my summary, because of the growing global economy, technological advancement and proliferation in financial products and services, such as easy availability of loans, individuals can easily find themselves caught up in an unpropitious economic situation, according to Tirawat, which could also be caused by improper financial management. To compound this problem, stress-related financial strain has a negative impact on student well-being, as postulated by Moore. And financial stress is a significant negative predictor of life satisfaction among Filipino students, the study of Bernardo and Resurrection. Furthermore, surveys around the world show that young adults have amongst the lowest level of financial literacy according to the OECD, and are found to be financially precarious because of poor financial literacy, lack of money management, and income instability, according to Jinha. So this is reflected by their general inability to choose the right financial product and often a lack of interest in undertaking sound financial planning. Also, Fatoki, Chen, and Volpe found that non-business college students have a low level of financial literacy. Thus, this study seeks to measure the level of financial literacy among undergraduate medical students attending medical schools in Leyte and find its impact on the students' well-being. The result of this study will benefit institutions in including or improving financial-related subjects in their curriculum so as to protect the well-being of their future doctors. So, for my research problem, The study aims to determine the level of financial literacy and its impact on the well-being, particularly of the undergraduate medical students attending medical schools in Leyte. And my specific objectives include to assess the level of financial literacy regarding personal finance with financial knowledge, financial skills, and financial attitude, and to evaluate the demographic and financial factors which could influence a higher or lower financial literacy. So these demographic factors includes the patient, the participants' age, their family income, whether they live in rural or urban areas, mga ganun po. For my methodology, I will employ the cross-sectional study design to predict higher or lower financial literacy levels and its impact on well-being. And the population I will include in my study will be medical students attending in the first year to the fourth year of medical schools in Leyte. For my inclusion criteria, medical students attending or enrolled in medical schools in Leyte with age of 18 years old and above are Filipino and of course are located in Leyte. And for my exclusion criteria, non-medical students and with the age of less than 18 years old. So this is how I computed my sample size using the Yamane formula,
If I may
assuming
add
the total
sir,
population of enrolled medical students in Leyte is 1,000. So ito po yung formula na gagamitin ko. Where the small n is the sample size, and the capital N is the population, and the
1
E
minute.
is the margin of error, which is 0.05 or 5%. So using this formula, I will arrive at a sample size of 286. For my variables, the independent variable are the key variables of financial literacy, namely financial knowledge, financial skills, and financial attitude. And for the dependent variable, the well-being of medical students attending medical schools. And for my data processing and analysis, I will use ANOVA or analysis of variance in analyzing the data gathered. So that ends my presentation. Thank you so much for your attention.
Thank you, Kim. Thank you for the presentation.
if I may
Next
add
will be
po,
Sheila, I think. Miss
Opo,
Sophie.
if I may add po, ma'am, when the student also enrolls, may
Wait lang po,
may tinatawag pong surety agreement. Kasama po sa pipirma doon is the guardian, meaning the parents.
Are you
So
able to
they are
share
made aware
your slides?
also of the responsibilities of the scholar. So kasama po sila sa pipirma agreement. So ang tama din po yung sabi ni ma'am kanina. This will be her third RSA with the university. Particular third case, if i-reiterate niyo ulit sa kanya yung
TJ, would you like to
lalo na ito yung medyo
start na lang, and then after you, we'll have Sheila.
And I believe also that she has been endorsed well by Coronadal kasi ang proseso po namin sa enrollment sa medicine, wala pong direct enrollment na
Good afternoon, everyone.
The student cannot go to me as the department chair and say I want to enroll. Dadaan po yan.
Allow me to present first. Next na lang po si Ate Nancy. Am I audible, Doc?
Yes, yes, we can hear you.
Okay. So, good afternoon, everyone. So, this is my research proposal. So since the pandemic has been ongoing for more than a year, we've faced several problems, one of which was the time when we all stayed at home. So because of the nationwide lockdown, everyone was forced to stay at home, giving us the opportunity to spend more time with our families and pets. Because of people are always in their pets at home, it is unavoidable that they may be beaten, resulting in an animal bite incident. So that is why I made a study, a comparative study to the incidence rate of animal bite cases during the pandemic period in comparison to pre-pandemic period in the province of South Cotabato. So this study is a study of animal bite incidents in the province of South Cotabato, in which the difference in the increase of cases are being compared over the two time periods, the pre-pandemic period which runs from January 2016 to March 10, 2020, and the pandemic period, which runs from March 11, 2020 to present day. So I included only January 2016 to include multi-year trend, and the declaration of the pandemic by the WHO is on March 11 of 2020. So I considered it as the beginning of the pandemic period. So what is the research problem? My research problem, this study tends to seek the answers for the following questions. Are there any significant changes in the reported animal bite cases during the pandemic period compared to pre-pandemic period? And is there a larger increase in cases during the pandemic period than the pre-pandemic period? So that is the research problem. The next one is my objectives. So generally, the goal of this study is to investigate if there are any significant differences in the number of animal bite incidents between the pandemic and pre-pandemic periods, starting from animal bite cases reports of 2016 to 2021. So specific objectives is to create a consent to the conduct of the study to ensure the anonymity of the data gathered. This research aims to identify what's causing the rise in animal bite cases. So the study will be gathering secondary data from the animal bite treatment centers in the province of South Cotabato from January of 2016 to September of 2021. So this study is limited to the reported animal bite cases for house pets only, specifically dogs and cats. So if the results will show that during the pandemic period has a higher number of incidents compared to the pre-pandemic period, then it is the time for us to innovate and to optimize the responsibilities of a pet owner as stated in the Section 5 of the Anti-Rabies Act of 2007. I will the study design. This study will use descriptive, purposive, and non-anonymous design since it is feasible and all the data needed are provided by the animal bite treatment centers in South Cotabato. This involves the use of prospective or retrospective data from the animal bite centers as the control group in the periods of January 1, 2016 to present, which is September 11, 2021. So I will be gathering the age, gender, and the type of animal bite will be extracted from the medical records, and consent will be prepared for the data gathering for the conduct of the study, ensuring the anonymity of the identity of the respondents, and data gathered from this study will be analyzed using the descriptive statistics and displayed via bar graphs and line graphs. So this is the whole proposal of my research. Thank you.
Thank you, TJ, for that. So yeah, you're more than 30 seconds pa. Thank you for keeping the time. So let's now proceed. Is Shallow available now to present her proposal? Shallow, di ka namin narinig. I think you also need to share the audio. Share audio. So when you share, click share audio also.
Yung volume ata.
No, when you share the slides, you click share audio also. Share audio because hindi siya automatic nag-share ng audio ng video. So share screen, you will have share sound option.
Dear panelists, good morning. Today, I will be presenting a research proposal entitled Stressors and Coping Strategies Among Senior High School Students in Lake Cebu Performance During COVID-19 Pandemic. So for the statement of the problem, COVID-19 is a global public emergency that is continuing to exert pressures and disruptions in various sectors of the country, one of which is in the education sector. It had exacerbated pre-existing educational disparities and forced to stimulate innovations to address the learning crisis in the country. Many learners are pressured to adapt to the new modes of instructions with expected great learning loss and rippling effect to the well-being and overall academic performance of the students. The findings from this study can be used by the Department of Education, LGU officials, and other policymakers in the municipality as basis and guide for policymaking, evaluation, and program implementation. The outcomes of the study can therefore guide the Department of Education in assessing the effectiveness of modular classes in other forms of remote learning activities to address the changes academic performance, and existing mental health concerns that comes with the change in education system. This study is grounded in the theory of Lev Vygotsky's principle of social development theory. Organization affects the learning process of an individual. It also believes that the distance between the actual learning and the
Shallow. She got disconnected. Shallow, are you able to share your video? Are you still having internet connection problems? Well, while waiting for Shallow, maybe Rafi.
will be using a cross-sectional study to explore the data from the respondents and determine the relationships between the different variables of interest. The target respondents of this research include the senior high school students in Lake Cebu National High School affected by the academic system change. And the data gathered will be collated and analyzed using the score distribution for the British Broadcasting Corporation Subjective Wellbeing or BBC SWB modified questionnaire, which will map across different domains commonly included in the definition of well-being. This will be correlated with the overall academic performance of the respondents in the same year. So that would be all. Thank you.
Thank you, Shallow, for the presentation. So now we could move on to Rafi.
Naririnig po ba ako, Doc?
Yes, we can hear you.
Good afternoon, everyone. I will be presenting my research proposal entitled The PhilPen Protocol Implementation in Primary Healthcare Facilities in Carmen Bohol, a retrospective review study. I am interested in this implementation research topic because non-communicable lifestyle diseases are the major cause of morbidity and mortality globally. Because of this, the WHO issued the package of essential non-communicable interventions for primary health care in low-resource settings in 2010. It was adopted by many countries, including the Philippines. The Philippine Package of Essential NCD Interventions, the PhilPEN, was issued in 2012. In 2013, the PhilHealth adopted a protocol. On March 11, 2020, the WHO proclaimed COVID-19 pandemic. Long-term quarantine can lead to a rise in lifestyle disorders, particularly cardiovascular diseases and obesity. So my research problem is there a significant difference in the indicators before and after PhilPEN protocol implementation in Carmen Bohol? To answer this, the research objectives are the following. First, to describe the demographic data of registered NCD patients on PhilPEN protocol. Second, to identify the pre-existing heredofamilial disease. Third, to determine the indicators before and after the PhilPEN protocol was implemented. And lastly, to compare and analyze the pre and post indicators of PhilPEN protocol implementation. To strengthen my study, I have reviewed some literatures from Scopus of the UPLM Library. According to my readings, a retrospective study on the implementation of WHO PEN interventions in Palestine was done. There was no association between parameters before and after WHO PEN treatments according to the findings. However, in a retrospective study in Moldova in 2018 and a pilot study in the Democratic Peoples of Republic of Korea in 2017 shows positive correlation or improvement after WHO PEN implementation. These literatures that I have reviewed show some gaps and consistency of results about the research topic. The figure below shows the significance of PhilPEN protocol of the NCD patients after its implementation. The pre and post indicators measure the degree of risk among NCD patients. BHS and RHU provide the PhilPEN interventions. This study will use the retrospective quantitative design. It will be used to review secondary data that is available in the RHU. It will be conducted at the municipality of Carmen Bohol. Subjects that we involved are 800 NCD patients who were enrolled in the PhilPEN protocol in Carmen Bohol from April 2016 to April 2018. The sample size was computed using the Cochrane's formula, the confidence level of 95% and a 5% margin of error. Simple random sampling was used for subject selection. In my computation, a total of 260 files will be included. Registered NCD patients who had their files updated according to the PEN protocol and are followed up by a primary healthcare provider will be included in the study, while patients who had insufficient information in their medical records are excluded. Next, variables in the study are demographic data, pre-existing heredofamilial disease, behavioral data, and pre-post indicators before and after implementation. The following indicators are BP, FBS, cholesterol level, BMI, and waist circumference. Lastly, our statistical software will be used to handle and analyze the data. Means will be used to represent the continuous variables like age. Numbers and percentages will be used to represent categorical characteristics such as gender and pre-existing heredofamilial diseases. The paired t-test will be utilized to test for differences between quantitative variables. Statistical significance is defined as a p-value of less than 0.05. That's all for my research proposal. Thank you for listening and God bless us all.
Thank you, Rafi, for that presentation. Thank you also for keeping the time. Now let's proceed to Swani. Swani, are you ready to show your presentation? Sige, Swani, you can go ahead. Swani, do you have an audio? I could not hear it yet.
Doc,
Yes.
pardon Doc.
Wala kayong marinig na ano, hindi namin marinig yung audio. Swanee, wala pa rin. So maybe you could check your settings. Yeah, maybe you could skip Swanee first. Swanee, you just work first on the technical issues of your presentation. Then maybe we could proceed to the next one, and then we'll just go back to you afterwards. Okay, so we can proceed with Isaiah Eliab, if it's okay. Thank you. Isaiah, are you ready? Is Isaiah Eliab around? Yes, Isaiah, are you ready to present? Isaiah? Isaiah, are you okay to proceed, or you want to have more time to prepare your slides?
Doc, I need time to prepare my slides po.
Okay, so maybe we could skip Isaiah for the moment. Edelmer Escueta. Pwede ka na pang mag-share.
Yes, Doc.
Okay, please go ahead. Thank you.
Ate Rhea, yan, thank you. Okay, Doc. Good afternoon, Doc. Good afternoon, classmates. So this is my proposal. So pinaiksi ko lang siya. So yung proposal ko is about the feeding practices and nutritional status among children, which is yung 6 to 12 months in Dipakula, Aurora. So the problem, this study intends to investigate the association between feeding practices of indigent mothers while their children are at 0 to 6 months and the present nutritional status among children 6 to 12 months of age in municipality of Dipakolo. So I intend to include na rin siguro, Doc, yung Feber po. Lahat na lang din siguro kasi baka makulang or baka mauntian ako ng respondent. So kukunin ko yung feeding practices nila ng mga bata while 0 to 6 months, and then yung after 6 months, doon ko kukunin yung present nutritional status. So ang objectives ko, main objective ko to determine the association of feeding practices and the nutritional status among 6 to 12 months children, and specific objectives ko to know the socio-demographic profile ng family ng children ng 6 to 12 months. Then yung feeding practices ng mga 6 to 12 months noong 0 to 6 months pa sila. And then, of course, yung nutritional status nila presently. And then, of course, to determine the relationship of these feeding practices to the child's nutritional status. So for my literature review, yung pattern ko dito, Doc, first is include ko yung breastfeeding, what is breast milk, the exclusive breastfeeding, importance and advantages of exclusive breastfeeding for or to infant. And formula feeding naman, i-discuss ko dito yung infant formula, yung advantages and disadvantages ng cow's milk, and the formula feeding sa mga infant natin. Then mixed feeding, ano yung advantages and disadvantages naman ng mixed. So yung mixed dito is the breastfeeding, breast milk plus the infant formula. For the methodology, the design of this study is prospective cohort design. So it examines the effect of the feeding practices during the age of 0 to 6 months on the present child's nutritional status. So, yun yung design. And the selection of respondents, so my inclusion criteria would be indigent mothers with children aging 6 to 12 months, syempre. Then, yung criteria ko dito na nilagay for to include is children born via vaginal delivery only. So, hindi ko sasali yung via CS. For my exclusion, children with history of hospitalization due to illness. So, magsaselect ako ng mga hindi na hospitalized. And for the sampling technique, ira-random sampling ko na lang sila. For the variables, the independent variables are the socio-demographic status ng family ng children. So dito yung na ulit. So yung age ng mother, so highest educational attainment ng mother, the highest educational attainment ng mother, then family income, occupation of mother. So kasi titingnan ito kung may relationship din siya sa nutritional status eventually. Then dependent variable, ito yung mga parameters for nutritional status like weight for age, height for age, and the weight for height. For the intervening factors natin, ito nga yung mga feeding practices, the exclusive breastfeeding, mixed feeding, and the formula feeding. So yun lang, Doc. It was short, very, very short talk.
Okay, thank you, Adelma, for keeping the time also, and also for your presentation. So maybe you could go back now to Swani. Swani, are you able to present now?
Doc, nag-upload pa lang, Doc. Sinend ko kay TG, Doc.
Okay,
Kasi mahina po yung net dito.
Okay, sure. Thank you. Kaya, are you okay to present now, or are you okay to start the presentation? Or you still need more time? TJ? Okay, good. Thank you.
Okay na po, Doc.
Go ahead.
So good afternoon, everyone. I will be presenting my research proposal. So the title would be Knowledge, Attitude, and Practices of Healthcare Providers in the Barangay Health Stations and Integrated Management of Childhood Illnesses in Ifugao. For the background of study, the MCI was developed by the WHO and UNICEF in response to the high number of deaths among children less than 5 years old. The aim of this program is to improve the coverage of essential child health interventions by improving case management skills of first-level nursing personnel, strengthen the health system for effective management of sick children, and to promote good community childcare practices. In the Philippines, the IMCI program was adopted in 1996. An evaluation on the status of IMCI program implementation in 2013 by the WHO showed that the Philippines had effectively adopted the guidelines of IMCI, with 72% districts implementing IMCI. The success of IMCI strategy in reducing child mortality can be achieved through the healthcare providers in the primary care facilities in the country. A study conducted by AHINES in 2004 showed that knowledge, attitude, and practices play a great role in service providers' implementation of IMCI. As per knowledge of the researcher, there are no available data on knowledge, attitude, and practices of healthcare providers about IMCI in the barangay health stations in Ifugao. Therefore, it is necessary to assess knowledge, attitude, and practices of healthcare providers in the barangay health stations in Ifugao. So for the objectives of this study, the primary objective of this study is to assess the level of knowledge, attitude, and practices of healthcare providers in Ifugao, and to determine the relationship of the socio-demographic profile of the healthcare providers to their level of knowledge, attitude, and practices towards IMCI. For the research design, a descriptive cross-sectional quantitative research design will be used by the researcher. The correlational design will be used to determine the relationship of the socio-demographic profile of the respondents to their knowledge, attitude, and practices towards IMCI. A semi-structured IMCI guidelines-based questionnaires will be used as a study tool. The questionnaire will be consisted of 4 parts. The first part would be on the socio-demographic data of the respondents, and the other 3 parts will be on the knowledge, attitude, and practices of the healthcare providers. Likert scale will be used in the questionnaire to gauge the level of the knowledge, attitude, and practices of the healthcare workers. For the sample population, the study population includes healthcare providers, the nurses and the midwives assigned in the barangay health stations in Ifugao. Using universal sampling method, all nurses and midwives that are assigned in the 191 barangay health stations of Ifugao will be included in the study. For the inclusion criteria, nurses and midwives who are assigned the barangay health stations in Ifugao, nurses and midwives who show their willingness to participate in the study. For the exclusion criteria, nurses and midwives who did not consent to participate in the study, and those who are on leave or not present during the conduct of the study. For the statistical treatment, descriptive analysis will be used to summarize the quantitative variables. Chi-square will be used to determine the relationship of the socio-demographic data and the level of knowledge, attitude, and practices of the respondents. That's all for my research proposal, Doc. Thank you.
Thank you, Zaya, for the presentation and also for keeping the time. So we now proceed to next presenter. Swani, are you able to present?
20 MB pa po,
Hindi pa
Doc.
rin. Okay. Sige. So just tell me in the
Opo.
chat box anytime you're ready. Okay?
Yes po, Doc. Yes po, Doc.
So the next one will be, is it Mylene? Indago. Mylene, are you able to present? You can share your screen now if you are ready. Oh, connected also. Okay. Mylene, can you hear us now, Mylene? Are you able to present already, or do you need more time? Okay. Good.
Hello?
Yes, go ahead. Go ahead.
Kita po yung screen ko?
Nawala yung screen. Ayun, yeah, we see it now.
Okay.
Yeah, go ahead.
Hi. Good afternoon, everyone. So this is my research proposal. The title is Relationship of Socioeconomic Status and Health-Seeking Behavior of Middle-Aged Population in Uong Hingyan, Ifugao. So this is a quantitative study which focuses on the relationship of socioeconomic status and health-seeking behavior of a subgroup of population from a rural barangay of Hingyan in the province of Ifugao. Some studies have identified socioeconomic status as one of the factors affecting people's health-seeking behavior. Thus, the study aims to know the relationship of both. It will be done through questionnaires to be distributed to the 276 participants selected through random sampling. Participants are the middle-aged population of Uong, age 32. So there are limited studies which focuses on subgroups from the rural communities. Thus, this study will be conducted in a specific subgroup of population. So health-seeking behaviors are closely linked with the health status of a nation and thus its economic development. Several studies have described health-seeking behavior within the context of various diseases. However, knowledge of HSB and how it is influenced by socioeconomic status among population subgroups is still scanty. This study aims to determine how socioeconomic status affects how people behave toward health. For the statement of the problem, the study aims to know the relationship of socioeconomic status and health-seeking behavior of middle-aged population in Uunghing and Ifugao. It will be conducted particularly to answer the following. What are the socioeconomic profiles of middle-aged population in Uung? How much is the total monthly income of the families of the middle-aged population? What is the socioeconomic status of the respondents? What are the health-seeking behaviors? And what is the relationship of socioeconomic status and health-seeking behavior of the middle-aged population in Uunghing. So the hypothesis is the socioeconomic status of middle-aged population significantly affects their health-seeking behavior. For the scope and limitation, this study will be limited only to the middle-aged people of Barangay Uunghing and Ifugao, which is age 36 to 64, both male and female, to determine their health-seeking behaviors and their socioeconomic status. As the study will be conducted only in a specific barangay, the sample cannot probably be a representative of the general population. For the theoretical background, from the review of related literature, I have come up with a conceptual framework. So this, the variable, the first variable, which is the socioeconomic factors, directly affects the income, which in the Philippines is used to classify the socioeconomic status of an individual or the family. And this socioeconomic status affects the health-seeking behavior. But the first variable, which are the socioeconomic factors, may individually or as a group affects the health-seeking behavior. But aside from these, there are other factors identified in some studies that affects the health-seeking behavior, which are the access to health services, service delivery, health insurance, type of illness, affordability of the services, etc. So for the methodology, quantitative research design will be applied in this study as it uses specific method and discipline procedures in gathering information needed in the study, and it includes the use of structural processes and methods like research instruments. Specifically, descriptive design, which is under the non-experimental design, will be used. For the study setting, the study will be conducted in Barangay Uunghing and Ifugao, CAR. So for the study populations, respondents will be the middle-aged group of Barangay Uunghing and Ifugao, and there are a total of 370 people who belongs to the middle-aged group. Applying the Slovin's formula by Slovin in 1960, which is where N stands for the total population of the middle-aged group, and E as the margin of error, which will be 3, there will be 276 respondents. Simple random sampling will be used in selecting the respondents, giving an equal chance or probability for all the middle-aged population to be selected. And specifically random sampling will be done through a lottery method where the samples are chosen randomly from a hat or a bowl. For the data collection will be done through a questionnaire to be distributed. A pivot study for the questionnaires will be done prior to the actual distribution to respondents. Their questionnaire will have two parts. The first part will be to gather information about the respondent's socio-demographic profile or personal data, which includes the age, sex, educational attainment, occupation, income, and the number of household members. And the second part will be the questions on healthcare preferences, when and where they do seek help in terms of health, their own reasons or factors which made them decide to do so, and how frequent do they seek help from health facilities if they do. It will also include questions about decision-making when health problems or needs arise in the family or the household. And these are my references. And this is the Slovin's formula that I use in selecting the number of respondents. Thank you.
Thank you, Marilyn, for the presentation. We now proceed to Abayan. If you're ready, you can share your screen.
Stage.
Like
Wait lang, sir, i-prepare ko lang po.
Okay.
Good afternoon, everyone. My research is entitled Determinants of Open Defecation Among Households in San Antonio, Northern Samar. Let's break down the title. First, determinants. It is defined as the factor of which decisively affects the nature or outcome of something. In this study, it is used to determine various factors or determinants of open defecation among household heads in San Antonio, Northern Samar pertains to the respondents of the study. Let's proceed to the introduction of the study. To start off, let's define open defecation. It is used to describe when individual feces are disposed of in the fields, forests, bushes, beaches, and other open spaces. Over the years, it has been considered a critical health challenge, most especially in Asian countries. According to one study, the main reason for open defecation in Asia is a lack of infrastructure caused by poverty. Those locked toilets lead to defecation in open spaces. Many studies have indicated that it is a form of religious belief wherein people choose open defecation as their mode of socialization for convenient choices. Moreover, in the Philippines, open defecation only perpetuates a cycle of disease and poverty. Several reasons are being argued as determinants of open defecation. Hence, this study primarily aims to determine determinants of open defecation among households in municipality of San Antonio. Next, I will be discussing the statement of the problem. This study aims to determine the determinants of open defecation among households in municipality of San Antonio. Specifically, it sought to determine the socio-demographic profile of the household heads in terms of sex, age, marital status, household size, level of education, occupation, and income. It also sought to determine the socio-economic and cultural factors determining open defecation, assess the knowledge, attitude, and practices of households on open defecation, identify if there is a significant relationship between the determinants of open defecation among households with respect to their socio-demographic profile, and based on the findings, what output can be proposed. You might ask why I intend to pursue this study. First, it is a contemporary and occurring issue kasi sa aming LGU scorecard, read yung open defecation since 2017 until now. Second, it allowed to seek answers regarding the determinants of open defecation. And lastly, it can provide helpful data or information for households, the environment, the municipality of San Antonio, researchers, and future researches. For the research design, this study will use a mixed method approach including quantitative and qualitative in thematic analysis. Quantitative will be used to assess personal data of the respondents, fecal disposal practices, and the knowledge, attitude, and practices on open defecation. Qualitative will be elaborating more on the socioeconomic and cultural factors, thus giving a deeper meaning to the situation. A mixed method study provides balanced perspective by incorporating the advantages of both method while also compensating for the drawbacks that result from one method alone. For the sampling procedure, the sample size estimation are determined using this formula, which yielded a sample size of 217 households. There are 10 barangays in San Antonio, so the sample size for each barangay will be 22 households. The respondents will be chosen using both probability and non-probability sampling technique. A simple random sampling will be used to select 22 households to ensure an unbiased study. Purposive sampling will be used for the key informants. They will be chosen based on their willingness. There will be an estimated 31 informants comprising the barangay captains, barangay kagawad on health, nurses, sanitary inspectors, and rural health midwives assigned in each barangay. That's all. Thank you.
Thank you for that presentation. We now proceed to Daldas. Charmaine, are you ready?
Ready na po daw yung video ni Ate Shwani, Doc.
Okay, yung kay Swanee muna. Okay, Swanee, please go ahead.
Good afternoon, everyone. I would like to present my research proposal about the healthcare innovation implemented by RHU San Jorge and Gandara District Hospital during this pandemic. The table of contents or the background, the research problem, research objectives, research question, conceptual framework, research methodology. The background of the study is the outbreak of COVID-19 disease has posed great challenges to the worldwide economy and people's daily lives and will have far-reaching consequences beyond the spread of the disease. At the same time, crisis is also a stronger driver of creativity and innovation. Indeed, if examined closely, one can already observe abundant creativity and innovation emerging at the national, institutional, organizational, and individual levels within the countries affected by COVID-19. The research problem, the management of the COVID-19 pandemic and other public health emergencies and disasters of similar scale is an intersectoral effort requiring comprehensive strategies that the different dimension of its impact on the society. This study intends to determine the healthcare innovation implemented by RHU San Jorge and Gandara District Samar. Research objectives is to how to ensure the immediate response to COVID-19 also takes into account the policies, the strategies, innovative ideas created and implemented during this pandemic. Research questions: what are the appropriate policies created, strategies, and innovation implemented during pandemic? Conceptual framework: many of the innovation in healthcare have been initiated by the healthcare stakeholders, the patient advocacy groups, healthcare organizations, physicians, other healthcare professionals. In some cases, the need for change is forced upon the healthcare organization by the government in an effort to mitigate healthcare concerns and challenges. Once the need is identified, the next challenge lies in determining whether the need can be met internally or healthcare innovation. If the innovation originates from within the healthcare organizations, it is tested, modified, adapted. In certain cases, a healthcare innovation takes my white perfect attempt at innovation from a healthcare organization and refines it to be better, and then markets it to healthcare organization. It is important to understand the internal process of innovation within the healthcare organization, such as hospital, nursing home, nursing health, or managed care company. These organizations typically do not have the luxury of a huge research and development department, and so must rely the raw talent, creativity of internal staff and work teams. Methodology: the research is qualitative type of research which can be used study within the inclusion criteria. Qualitative data will be obtained through interviews from focus group discussion and key informant interview. The data will be obtained through secondary data and review of documents. Multi-stakeholder approach is used in this study to gather the data from the municipal health officer, chief of hospital, public health nurse, chief nurse, head nurse, midwife, nursing attendant, and member of the health. The instrumentation, the tool used in this study is a semi-instructed questionnaire for key informant interview and focus group discussion. The key informant interview questionnaires includes guide questions eliciting a description of their line of work and its relation to the conduct and implementation for healthcare innovation, types of healthcare services offered in health facility, challenges encountered in the delivery of these services, and possible solution to address it from their perspective. Data collection method, the different data that are utilized in the study were gathered using several methods. Focus group discussion refers to a qualitative data collection between 6 and 10 individuals with similar background or experience are brought together to discuss a specific topic of interest with the researcher. The researcher gathered the respondents of focus group discussion based on their preferred schedule. Data analysis and processing. Data collected during the focus group discussion and key informant interviews were digitally recorded and transcribed verbatim. A main transcript of all interviews was made. Thematic analysis was used to arrange and group the qualitative data. Variables were encoded and analyzed using open and axial coding of the transcript. I think this is the last slide. Thank you for listening.
Ms. Wani for the presentation. So let's now proceed to the next presenter. Is it Charmaine? Or May?
Good afternoon, Doc. Good afternoon, everyone. I will be presenting the study on the factors affecting access to maintenance medication among hypertensives in Maydolong Eastern Samar. Hypertension is one of the health problems in Maydolong Eastern Samar, and this even remains to be the leading cause of illness and is said to be one of the identified precipitating factors of premature death in the Philippines. Some of the hypertensive individuals do not have access to antihypertensive drugs, and the lack of access to these essential drugs would aggravate this health problem, leading to increased risk of mortality from this disease. This study aims to determine the factors that affects the access to maintenance medication among hypertensives to address this problem. This study will utilize descriptive design to identify the factors that affects the access to maintenance medication among hypertensives using a survey questionnaire. The result of the study will help improve the health service delivery on non-communicable diseases programs, specifically hypertension, in ensuring access to hypertensive drugs. For the background of the study, 1 in every 3 adults suffers from high blood pressure that leads them to heart attack and stroke worldwide. High blood pressure, also called hypertension, is blood pressure that's higher than normal. Management of this health problem is necessary to prevent the development of any complications, and this includes drug therapy if lifestyle modification cannot adequately bring the blood pressure to goal. But access to these antihypertensive drugs is still a challenge for most of the hypertensive individuals, which then contributes to the increased risk of developing complications, which can lead to premature death. A large proportion of communities in low-income and middle-income countries do not have access to more than one blood pressure lowering medicine, and when available, they are often not available. This is according to a study. The high price of antihypertensive drug is one major barrier to patient access and adherence to this medication. This study aims to determine the factors that affects the access to maintenance medication among the hypertensive individuals aging 25 years old and above. It seeks to answer the question, do patients have access to antihypertensive maintenance medication? What are the factors affecting the access to maintenance medication among hypertensives aging 25 years old and above? And this study aims to assess the access to maintenance medication among hypertensives in Maydolong Eastern Samar. Specifically, this aims to identify the factors that affects the access to maintenance medication among hypertensives aging 25 years old and above. This study will utilize descriptive design to identify the factors that affects the access to maintenance medication among hypertensives aging 25 years old and above. This is a type of study in which information will be collected without making any changes to the study subject. For the sampling design, the respondents will be selected through multi-stage sampling design by 4 stages. The first stage is the arbitrary selection of the municipality of Maydolong Eastern Samar. Next is the random selection of the 10 barangays Walaya, namely Campacaret, Lapgap, Gintalitan, Kamada, May Bukog, May Tiktaw, Poblacion 7, 5, 2, and 1. Next stage is the identification of hypertensive individuals aging 25 years old and above. And from the 10 barangays that were randomly selected, the respondents of the study will be the identified individuals who qualify based on the inclusion and exclusion criteria. The last stage is the identification of sample size of the study that will consist of 27 hypertensive individuals from each of the selected barangay, a total of 270 hypertensive individuals. That's all. Thank you.
Thank you for that presentation, Charmaine. So let's now proceed to the next presentation. Who's
Tid.
coming?
Ako daw.
Kay Toto, go ahead.
Page.
Yes, Kuya To, setting up. Wait lang. Saglit. Okay na po.
Okay, go ahead, please. Toto, go ahead, please. Walang audio. So we don't hear the audio talk. Is there an option to share audio in the presentation? There again. Si TJ na lang daw mag-screen share to.
Am I audible, Doc? Am I audible na, Doc?
Yeah, we can hear you now. Go ahead.
Okay, Doc. So again, my title research comparison of nutritional status and associated factors of pregnant women between lowland and upland barangays in Tiboli, South Cotabato. So for the background of the study, undernutrition is perhaps one of the contributing factor to burden of the disease, particularly for women who are lactating and pregnant. It is also linked to a high maternal morbidity and mortality rate. Malnutrition is one of the devastating problem worldwide and is exaggerated by the current situation caused by the COVID-19 pandemic. It is also recognized as a public health problem, especially in developing countries, mostly affecting children, women, and of childbearing age and pregnancy. According to World Health Organizations, millions of people are suffering from different forms of malnutrition. In fact, 1.9 billion adults are overweight or obese, while 462 million are underweight. Pregnant women are generally of high risk for malnutrition during pregnancy and lactation, where the caloric need is significantly higher than a non-pregnant woman, not just to satisfy herself, but also to sustain good development and growth of the fetus in the womb. Poor nutritional status of a pregnant woman or lactating mother manifests in the nutritional status of her child and also predisposes them to high morbidity and mortality rate. According to the UNICEF, before pregnancy, women need nutritious and safe diets to establish sufficient reserves for pregnancy. During pregnancy and breastfeeding, energy and nutrient needs increase. Meeting them is critical for women's health and that of their child in the womb and throughout their early childhood. According to the Philippines National Nutrition Survey, reported that Philippines region has a relatively higher prevalence of undernutrition are found in the Bangsamoro region at 45.2%. With the exception to the other regions, undernutrition is also prevalent but of lower percentage. However, there is insufficient information in the Philippines region to show undernutrition in pregnant women is prevalent in upland than lowland barangays. Therefore, the current study will be conducted to compare the prevalence and associated factors of undernutrition among pregnant women from upland and lowland barangays. Finally, the National Nutrition Council, researchers as well as the policymaker will use the information as the baseline data for their future nutrition intervention. So for the statement of the problem, is to compare the anthropometric nutritional status and identify its associated factors of pregnant women between lowland and upland barangays. So my general objectives is to determine the anthropometric measurements and associated factors that affect the nutritional status on the pregnant women between lowland and upland barangays. My specific objective is as follows: compare the nutritional status of the pregnant women between upland and lowland barangays, assess whether geographic location causes malnutrition, determine if there is significant difference on maternal health status between lowland and upland barangays, and four, describe the association of specific demographic characteristics of pregnant women between lowland and upland barangays. So for my study design, a community-based comparative prospective cohort study will be used in the study. Sample size will be determined through infinite population formula. 50 pregnant women in upland communities and 50 pregnant women in lowland communities will be enrolled in the study. A stratified sampling technique was used to stratify the study area to highland and lowland. The study participants were selected by simple random sampling technique. Data were collected using anthropometric measurements and structured questionnaire. Population and sample, the subject population will be included in the study are the pregnant women living in the lowland and upland barangays, 100 pregnant mothers, ages 19 to 45 years old from 5 upland barangays and 5 lowland barangays will be included in the study. The sampling technique, the 100 participants will be selected randomly. A stratified sampling technique will be used to stratify the into the lowland and highland. The municipality of Tiboli has a total of 35 barangays. Among these barangays, 9 of them were lowlands and 16 of them were highlands. Since the purpose of the study is to compare the two groups, thus 5 barangays from highland and lowland will be selected. Variables, independent and dependent variables. Nutritional status of pregnant mothers is the outcome variable, and the independent variables were all the socio-demographic characteristics, maternal obstetrical and gynecology history. A brief description of how some of these variables were measured is as follows. Dependent variable, the mid-upper arm circumference values below a cutoff point less than 23 centimeters were considered as undernutrition in the study, whereas for the pregnant mothers, 23 centimeter and above was considered normal. Potential confounding factors are variables measured in the study were sociodemographic characteristics and obstetrics and gynecological in the age of the mother, marital status, religion, educational background of mothers and household income, occupation, ethnicity, number of antenatal care visits, type of pregnancy, maternal previous surgery, malaria, parity, iron and folic acid supplementation, marriage at age, hemoglobin level, coffee intake, husband support, depression, difficulty to access food during the last 3 months, and history of low birth weight. So for the data processing analysis,
30
the raw data will
seconds.
be the raw data will be coded, intercleaned, and analyzed using specific research instrument. The 90% confidence level will be used in significance analysis. The association between each variable will be dependent variable, will be examined through bivariate analysis by computing odds ratio of 90% confidence level. Variables from bivariate analysis will be transferred to multivariable logistic regression using p-value of less than 0.25 to identify factors associated with outcome variables. Multiple logistic regressions at 90% confidence level will be used in the study. A p-value of less than 0.05 will be considered as statistically significant. Ethical considerations. This study will comply with the ethical principles contained in the 2013 Helsinki Declaration and the 2011 National Ethical Guidelines for Health and Health-Related Research of the Philippine Health Research Ethics Board. All study data will be anonymized to maintain the privacy of the participants, ensuring that no respondents will be coerced into joining the study. Informed consent and assent forms, as applicable, will be documented in writing for all participants after adequately explaining to them the study goals and methods. Respondents will be allowed to withdraw from the study at any time they wish to without fear of any repercussions. So that
Thank
would be
you.
all. Thank you.
Thank you, Toto, for your presentation. So we'll move on now to the next one. So Rachel, are you ready to present, Rachel? Yes, I am. So feel free to share your screen anytime. Go ahead, Rachel.
Hello, Dong. Sorry. Good afternoon, classmates. Good afternoon,
Afternoon.
Doc. So my research title is regarding the perception and autism aging 15 and above of selected barangays of Abuyog, Leyte. Autism spectrum disorder is a complex lifelong neurological disorder that affects the brain and development and behavior. So, according to CDC, ASD is a developmental disability that can cause significant social, communication, and behavioral changes. In the Philippines, we don't have current data on the prevalence rate of autism in the country. But according to CDC 2020, in US, about 1 in 54 children have been diagnosed with ASD. It has an increased rate of 10% from 1 in 68 from the year 2010. Nag-search po ako sa internet, Doc. Parang sa website ng DOH, wala pong prevalence rate. Pero sa Autism Society of the Philippines, meron silang data na 1 in every 100. Tapos sa Medical City website naman, meron silang 1 in every 100. In 2000, the American Neurology and Child Neurology recommend that all children should be screened for autistic spectrum sa US. Meanwhile, sa Philippines, yung House Bill number 6934, which is authored by Anak Bayan Representative Tomasito Villarin, also known as the National Autism Plan Act, which aims on the special needs of person with autism. There's also a study, Doc, from UP Manila, authored by Maria Isabel Kilindrino et al. On the parents' perception of autism and health-seeking behavior. It showed some trends that there's an improved awareness regarding autism. And then, meron din according to reason ng AM et al. University of London, meron silang mga identified sociocultural factors that help or hinder the inclusion of families with autistic children within the community. So yung mga perception disability, beliefs about causes of autism in Western world, tapos yung strong reliance on religious belief, understanding and accepting on autism diagnosis. Actually, marami pa akong nabasa about autism. Mga researchers abroad na it shows na meron na talagang mataas na trend ng awareness yung mga tao compared before. But as we can despite the parang kahit sabihin pa natin mataas na yung trend ng awareness, makikita pa rin natin na there's still a stigma. Kahit meron na tayong National Care Plan Act dito sa Philippines, meron pa rin stigma about autism. Marami pa rin yung walang alam about autism. And then, so gusto ko yung thesis ko na to kaya ko siya ginawa para kung yung National Care Plan Act ng Philippines is kung kasi nandiyan na siya, so gusto ko mas strengthen pa and then i-continue pa yung awareness raising campaign and education regarding autism. We should help others living with autism para maintindihan ng iba kung ano yung feeling ng may autism so that we can understand autism, yung taong may autism. So, this study aims to investigate the perception of the community people aging 15 and above in abuyog-related autism spectrum disorder. So these are the specific objectives: to assess the perception of community people on ASD, to know how people describe autism, to identify how people usually treat autism individuals, to identify what are the symptoms they usually suspect or see in a person with ASD, to identify the existing program of the LGU in ASD, to create a community full of love for ASD individuals. So significance of the study. So the purpose of this study is to assess the perception of the community people in ASD and give more understanding on how should we address the ASD in the community level. Furthermore, we can base from the study how the community can strengthen the identified intervention as it improves government programs and strengthen the continuum services in the communities that is existing. And lastly, to teach the community that our ASD patients are equally important as normal kids. Their needs in any aspect should also be given importance. Methodology, study design. The study will utilize descriptive qualitative method type of research. It aims to explore the community perception on autism spectrum disorder. So the study setting would be conducted in 2 barangay population in Abuyog, which is Barangay Nalibunan and Barangay Kanugib, and the 2 areas would be Jeddah, Barangay Bulak, and Barangay Tinilian. So the population, the respondents will be randomly selected individuals aging 15 and above. They will be selected through stratified sampling by the age range from 15 to 24 and 25 and above. At the age of 15, most of the teens know the right thing to do, which is but they are still self-centered, yung thoughts nila and behavior. And then the age of 25, yung tao is more rational, yung rational part ng brain is fully developed. So more mature decision and behavior. Inclusion, the study will include all randomly selected individuals based on their age 15 to 24 and 25 and above, inclusive, regardless of length of stay in the barangay, sex, affiliation, and ability to give informed consent. Exclusion, the study will exclude individuals who are less than 15 years of age at the date of interview and has not an ability to give informed consent. those persons who are in the medical field are also excluded. Sample size, yes, a sample size of 370 was selected to represent from the 4 barangays. Actually, I don't know kung ano talaga yung exact population. Parang inano ko na lang, Doc, na 5,000 in all. Wala pa kasi akong data for the 4 barangays. So, I use the Sloven's formula to compute for the sample size. So, the project population of individual aging 15 and above the 4 barangays is almost 5,000, considering 5% margin error. So, excuse me, no. And then, ito yung formula. So, 5,000 divided by 13.5 is equals 370.37 or 3.7 or 370. So, data processing and analysis. So, the studies aim to expand the perception of the participants about autism. So, the major data analysis will be done through descriptive statistics. A tabulated list of responses will be made based on the commonalities and differences of the answers. Ethical consideration or written consents will be obtained from all the selected participants, assuring the confidentiality and privacy. Thank you.
Okay, thank you, Rachel, for the presentation. So we'll now move on to Darren. Darren, are you ready to present? Darren Aya. Please share the screen if you're ready now. You can share your slides or your video.
Itong community.
Okay, go ahead, Darren. Just share screen.
Wala pa tayong
If you're ready to share your recorded presentation.
Wait, Doc, siniset up ko na po, Doc.
Post-traumatic stress disorder. Good afternoon, everyone. My research proposal is entitled Prevalence of Anxiety, Insomnia, Depressive, and Post-Traumatic Stress Disorder Symptoms Among Healthcare Workers in a Primary Level Hospital During the COVID-19 Pandemic in the Philippines. The novel coronavirus disease, or COVID-19, first detected in Wuhan, China, has rapidly spread to over 200 countries all over the world, thus its pandemic status. Despite WHO measures, the disease continues to affect millions and cause about 70,000 deaths per week worldwide. The Philippines reached a total of 2.28 million cases, making the country rank second among Southeast Asian nations with the highest number of COVID-19 cases. Death toll from the disease reached 36,000 on September 16, 2021. The negative impact of the COVID-19 pandemic on public health and economy is intensified for developing countries like the Philippines. Lack of resources, solid economies, and established healthcare infrastructures magnifies the struggles experienced during the pandemic in the country. With this, the Philippine health system is overwhelmed, posing physical, emotional, and psychological threats to health workers. Mental health conditions should be assessed and addressed immediately to prevent further mental health deterioration. Motivation and good mental health among healthcare workers are of utmost importance, especially during the pandemic, thus the importance of this study. The following are the specific research problems and research objectives. First is to determine the socio-demographic profile of the health workers in terms of age, gender, marital status, occupation, and highest educational attainment. Second is to determine the anxiety levels and the prevalence and severity of insomnia, depression, and PTSD symptoms among healthcare workers. And last is to determine the relationship among the social demographic profile of the health workers and their anxiety levels, severity of insomnia, depression, and PTSD symptoms. Studies revealed that mental health symptoms are associated with increased absenteeism, lower productivity, and lower morale, which could affect the performance of health workers. Thus, the need for assessment of their mental health status, especially during this pandemic. Literature reviews confirm the relatively high rates of symptoms of anxiety, depression, and PTSD and stress among healthcare professionals during the COVID-19 pandemic globally. Other studies concluded that healthcare professionals have increased risk for negative mental health outcomes compared to non-medical professionals. For studies in the Philippines, the study of Labrage confirms the experience of fear and psychological distress among healthcare workers, specifically nurses working in the community setting. Labrage also concluded in his study that the fear and psychological distress among the nurses is associated with increasing professional turnover intentions. Though several researchers discussed in detail the mental health impacts of COVID-19 pandemic among healthcare workers, a few studies are conducted in the Philippine setting, which is considered a low middle income country. Moreover, most hospital-based researches were conducted in urban hospitals, thus the need for assessment focusing on healthcare workers in a primary level hospital in a rural area. A descriptive quantitative research design will be used to assess the prevalence of mental health symptoms among the healthcare workers. A correlational study design will be applied to determine the relationship of the socio-demographic profile to the mental health symptoms of the respondents. And lastly, a cross-sectional self-report survey will be utilized to collect the data. The study will include all healthcare workers such as physicians, nurses, midwives, radiologic technicians, pharmacists, medical laboratory scientists, ambulance driver, and other administrative staff working in a specific primary level hospital in the country. The universal sampling method will be utilized wherein all the staff of the specific hospital will be included in the survey. Sample size would be the same as the population size. The dependent variables are the status of anxiety, insomnia, depression, and PTSD symptoms, while the independent variables are the socio-demographic profile of the health workers. Categorical variables will be presented in terms of number or frequency and percentages, while quantitative data will be summarized using measures of central tendencies such as mean and weighted mean. The chi-square test of independence at 0.05 level of significance will be used to determine the relationship among the socio-demographic variables and the mental health symptoms. The questionnaire will consist of 5 parts, including the demographic profile and then the assessment of the anxiety, insomnia, depression, and PTSD symptoms of the respondents. That would be all. Thank you so much for listening.
Thank you, Darren, for the presentation. Let's now move on to Hanami.
And then kung ano yung gagawin natin.
So good afternoon, Doc. Good afternoon, everyone. Am I audible?
Yes, we can hear you.
Okay, so once again, good afternoon, Doc, and good afternoon, classmates. So my proposal would dwell on the topic on the dietary habits and physical activity and their association to the perceived physical and mental well-being of Ifugao adolescents during the COVID-19 pandemic. Next slide, please, TJ. So why am I interested in studying this? Basically, the COVID-19 pandemic has brought a lot of restrictions in terms of mobility, in the access to food options in everyone in the world.
Thus, I would like to see if there is an association of the dietary habits and level of physical activity among adolescents in my province. Why adolescents? It is because the prevalence of adolescents has been noted by the World Health Organization, the UNICEF, and the FAO, that obesity has tripled over the last 15 years. And also in our province, there is not much database on the nutritional status of adolescents because there is no regular monitoring of their weight and height. Okay, so as we all know, these two, the dietary habits, poor dietary habits, and a sedentary lifestyle can contribute to the development of NCDs, which are the primary killers during adulthood. So next slide, please. So the study would like to provide answers to the following: the demographics characteristics of the adolescents in terms of sex, age, and location of residence, the dietary habits in terms of the frequency of having breakfast, the consumption of fruits and vegetables, the family meal frequency, and the consumption of sugar sweetened beverages. Also, the level of activity would be investigated in terms of the frequency of physical activity and the duration of screen time per day. These variables or dependent variables has been a product of my review of literature and studies. So these would be analyzed in terms of their relationship to the perceived physical and mental well-being of the adolescents in the study. So the BMI for age will be computed given the reported weight and height of the participants, and the general health and well-being and the stress and anxiety levels will be through a self-reported questionnaire. So next slide, please. So this is a conceptual framework. So basically all of the independent variables will be correlated or will be tested if they have an association to the reported physical and mental well-being of the involved adolescents. So next slide, please. So this will utilize the quantitative descriptive cross-sectional design, and the population involved would be the adolescents 10 to 19 years old residing in Ifugao during the COVID-19 pandemic. Using the Sloven's formula, I have computed the sample size to be 387. So the population of adolescents was based on the 2015 PSA census, and this yields 387 sample size. So the questionnaire will be floated via an online mechanism, and the snowball sampling will be utilized to recruit at least 387 participants to the study. The data will be processed and analyzed, and descriptive statistics like the mean, the frequencies, and the percentages will be used, and the Spearman R will be used for the correlation or to test for the correlation of the independent variables to the dependent variables. So that's all, and thank you for listening.
Thank you, Hannah, for the presentation. Thank you for taking time. Let's now proceed to Dolores. Dolores, you're ready to share.
Good day, everyone. This is Dolores, and I'll be presenting my research proposal. This study is entitled Factors Contributing to Compliance to Treatment Among Confirmed Pulmonary Tuberculosis Patients in Sigma Capiz. Tuberculosis is a communicable disease that remains a major cause of ill health. It is one of the top 10 leading causes of death. Globally, the Philippines remains one of the highest TB-burdened countries and continues to bear the health and socioeconomic consequences of TB. TB is curable and preventable. According to WHO, about 85% of the people who develop TB disease can be successfully treated with a 6-month drug regimen. However, such long-term strict regimen may lead to non-compliance to prescribed drugs. Compliance is necessary in achieving successful treatment outcomes, controlling the spread and preventing the development of drug resistance in TB. Although several factors, such as socioeconomic factors, regimen complexity, long duration of treatment, and pattern of healthcare delivery system, are known to affect adherence to TB drugs, the extent to which additional factors affects TB adherence needs to be explored. Thus, the researcher proposes this study to further identify the factors that contribute to compliance to treatment in the locality. In general, this study aims to determine the different factors that contribute to patients' compliance to TB treatment. Specifically, this will answer the following questions. First, how does the patient's social demographic data influence his compliance to treatment? Is there a significant relationship between the respondent's knowledge on TB disease and his compliance to treatment? What are the treatment-related factors that will affect the compliance of the patient? What is the effect of family support in relation to compliance to treatment? Do health workers play a significant factors in patients' compliance to treatment? To answer these research questions, the study adapts a WHO multidimensional adherence model as its paradigm, which illustrates the different factors that could contribute to patients' compliance to treatment. The different factors, as shown in this model, include socioeconomic factors. Socioeconomic is measured by number of factors that can either positively or negatively affect a person's life. Although it has not been consistently found to be an independent predictor of compliance, in developing countries, low socioeconomic status may put patients in the position of having to choose between competing priorities, such as to meet the need of the family. Patient-related factors. This study, patient-related factors include patients' knowledge regarding tuberculosis, beliefs, and social support. Studies show that lack of treatment literacy is associated with poor health outcomes, and conversely, treatment literacy improves health outcomes and compliance. Treatment-related factors. There are many therapy-related factors that affect compliance. Most emphasized are those related to the complexity of the medical regimen, duration of treatment, and experiencing side effects. Condition-related factors. These factors represent the illness-related demands encountered by the patients. Comorbidities, alcohol use, and smoking may also affect the compliance behavior of the patient. And lastly, healthcare system-related factors. In this study, patient-provider relationship will be assessed as a factor to consider in relation to compliance to treatment. Also, factors such as transportation and availability of medication will be identified. To assess these factors, a semi-structured questionnaire will be used. This questionnaire was structured based on the conceptual framework and is divided into 5 sections, namely socio-demographic factor, patient-related, treatment-related, condition-related, and healthcare system-related factors. It has 32 questions divided to the stated sections. The questionnaire will be translated to the local dialect to be utilized during the interview. For the methodology, a descriptive cross-sectional study will be used. This research method is considered the most appropriate since the study aims to describe the influences of different factors to compliance regardless of the treatment outcome. All confirmed pulmonary TB patients who underwent treatment at Sigma Rural Health Unit and Birthing Facility between the period of January 2019 to December 2020 will be included as the study population. Confirmed pulmonary TB patients should be 18 years old and above, regardless of sex and treatment classification. Either new or retreatment cases will be included. From 198 pulmonary TB patients who were registered during the proposed study period, 114 will be included in the study. To collect the necessary data, the researcher will first conduct a review of records using the patient's treatment record. This secondary data will be used to come up with a list of target participants. The researcher will then use a purposive sampling in the selection of actual participants. A personal interview using a questionnaire presented a while back will then be conducted to gather the primary data. The gathered data will be coded and classified per section. Answers to open-ended questions will be classified and scaled accordingly. A descriptive analysis will be used to analyze the data. Statistical analysis will be done using MS Excel in order to identify any significant relationships. And that's it. Thank you.
Thank you for presentation. So we now proceed to the next presenter,
Innovative products. Yun yung showcase.
Francis May.
Gagawa natin ng
Good afternoon, Doc. Good afternoon, classmates. So for my research, I am interested in knowing the psychological and occupational effects of COVID-19 outbreak among healthcare providers of Bauco Mountain Province after 1 year of pandemic. For the background, the COVID-19 has created unexpected demands on the healthcare system and has added to the already high levels of stress faced by healthcare workers. Several studies conducted during the pandemic reported occurrence of insomnia, depression, severe levels of anxiety, post-traumatic disorder, and burnout among healthcare workers. These existing studies that assess the impact of COVID-19 on healthcare workers' mental health are limited on hospital settings and in areas where there are high number of cases. Research that targets mental health evaluation of healthcare workers in rural areas are relatively scarce. Thus, this research aims to address the gap and know the long-term effects of COVID-19 in terms of psychological well-being and occupational impacts on healthcare workers after provision of at least 1 year service in the municipality of Bauco Mountain Province during the COVID-19 outbreak. For my specific research objectives, I would like to determine the psychological well-being of the healthcare staffs of Bauco Mountain Province, to know the occupational impact of COVID-19 among the healthcare providers, and lastly, to identify personal and systemic factors that increase vulnerability and their associations to the healthcare workers' mental health. So for this study design, a descriptive study design will be utilized to describe the distribution, socio-demographic, and characteristics of the study participants. In addition, an analytical cross-sectional study design will be used to investigate associations between personal and systemic factors with that of healthcare workers' mental health. So the study will be conducted in Bauco Mountain Province, which has an approximately 220 community-based healthcare workers. The healthcare workers will include the municipal health officer, rural health midwives, nurses, DOH deployed human resources for health, barangay health workers, and other volunteers who have at least served for 1 year during the COVID-19 outbreak. Participants will be recruited using a convenient sampling technique. For the data gathering, social media will be utilized, and that will be using electronic survey forms, and printed questionnaires coupled with guided interview will be done when deemed necessary. So the questionnaire will consist of 2 sections. For the first section, this will include socio-demographic and professional characteristics. For the second section, it will include modified assessments from the COVID-19 pandemic mental health questionnaire, which is a highly comprehensive questionnaire that covers various areas of interest affected by the COVID-19 pandemic. Also, in this section, other validated screening measures will be incorporated that will assess depression, anxiety, and stress using the ASS-21. To assess the quality of life, I will be using the WHO 5 scale. For the professional burnout, I will use the Maslach burnout inventory, and for the sleep quality, I will use the insomnia severity index. For the data analysis, consultation needs to be done. So that's all. Thank you.
Thank you, Francis May, for your presentation. Let's now proceed to the next presenter.
Good afternoon, everyone.
Good
afternoon. Okay, so my research proposal is entitled Self-Care Practices Among Pregnant Women in Sagada Mountain Province. Next slide, please. The content of my research proposal would be the introduction, the problem statement, research objectives, research questions, and significance of the study, and the following. Next slide, please. So about the background of my study is that in 2016, the WHO recommended 49 antenatal care for positive pregnancy experience to prevent maternal and neonatal death and complications, at the same time promote well-being of mother and her baby, especially in the community setting. And the Department of Health reported that both infant mortality rate and neonatal death rate increased from 11.9 to 12.6 infant deaths per 1,000 live births, from 4.5 to 24 fetal deaths per day in 2017 to 2018, respectively. And moreover, maternal mortality rate had an 11.1 increase from 1,484 to 1,600, or 1 per 1,000 population, as reported by the Philippine Health Statistics in 2018. And in fact, in a study conducted in 2012 to 2014 on self-care and remote care during pregnancy by Golmezoglu and others, self-care and remote care integration for pregnant women, especially during COVID-19 pandemic, should increase in order to improve the quality of care and maternal health outcomes, especially during this COVID-19 pandemic. Furthermore, in another study on self-attention for women living in rural area by Van der Sand and others, self-attention contributes in the formation of cultural pattern, which reiterates that a pregnant woman has a central role in her health, Thus, she needs to pay attention to herself and her pregnancy in order to promote and maintain a healthy pregnancy. Next slide, please. So the researcher seeks to answer the following questions. What are the socioeconomic statuses of the respondents in terms of age, place of residence, marital status, type of family, household size, level of education, occupation, and income? What are the reproductive information, including menstrual and obstetric history? What are the self-care practices of pregnant women in terms of nutrition, physical activity and sports, personal hygiene, prenatal services, burden of workload, rest and sleep, and others? And is there a significant relationship between socio-demographic profiles of the respondents and their self-care practices? Or is there a significant relationship between their self-care practices and their pregnancy outcomes? So the research objectives would include the following. The purpose of the study is to assess the self-care practices of pregnant women in Sagada Mountain Province, and specific objectives are to determine the socio-demographic statuses of the respondents in terms of age, level of education, occupation, and income, to assess the self-practices of pregnant women in terms of factors such as nutritional intake, physical activity, personal hygiene, prenatal services, rest and sleep, to evaluate the relationship between demographic characteristics of the respondents to their self-care practices during pregnancy, and to recommend programs and interventions to solve issues related to health and self-care behaviors during antepartum period of women. Next slide, please. The research design, the researcher will use a qualitative design, a prospective cohort study on self-care practices of pregnant women on their first trimester, and evaluation of health outcomes on their third trimester will be conducted. A group will be enrolled on wellness training besides the routine prenatal checkup, while the other group will be attending routine prenatal care. So sample and sampling scheme is that the respondents of the study are 263 pregnant women on their first trimester who are residing within the 19 barangays of Sagada Mountain Province and are enlisted in the RHU or in their respective barangay health centers during the first quarter of 2024. 90% confidence level with 1.64 Z-score and 5% margin of error is applied in the computation for the sample size. And the researcher will utilize non-probability method through purposive sampling. Inclusion and exclusion criteria will be done. And data collection and processing would include qualitative data will be collected using in-depth and semi-structured interviews containing open questions. And before conducting the interviews, the researcher reviews the questions and ways to obtain valid data, then focuses on research questions. The interviewer will pilot the interview on a subset of participants and will use the information to further refine the guide with respect to culturally sensitive and appropriate questions. Appropriate statistical treatment will be applied on the summarized gathered data. So that's all. Thank you for listening.
Thank you, Dorothy, for the presentation. Now let's go to the next presenter, Isaac Reyes. Go ahead, please.
Good afternoon, Doc. Good afternoon, everyone.
Good afternoon, Jaya.
My research proposal is about identifying the factors affecting COVID-19 vaccine hesitancy among the general adult population of Borongan City. So as the coronavirus pandemic continues to grip most of the world, our country, the Philippines, faces its most difficult hurdle yet, and that is launching the widespread COVID-19 vaccination campaign. However, many people remain hesitant to receive the vaccine, putting their lives and other lives in danger. So the goal of this research is to figure out what causes COVID-19 vaccine hesitancy in the general adult population. Is it related to their socio-demographic data, beliefs, and health practices based on the other literatures done in other countries? Or do the sources of information about COVID-19 vaccines and the vaccine's efficacy rate also influence the hesitancy, which was also seen from other studies in other countries? So, next slide. So It seeks to answer the question, what factors influence COVID-19 vaccine hesitancy among Borongan City's general adult population? This study will be utilizing a descriptive cross-sectional research design. This is a type of research in which data is gathered without any alterations to the research subject, and the researcher will be unable to engage directly with the environment in a way that would cause the experiment to change. Next slide, please. So the respondents will be chosen in 4 phases using the multi-stage sampling design. The city of Borongan is arbitrarily chosen in the first level, and using the wheelsofname.com or Roleta, the 5 barangays of Pipilitan, Barangay H, Cagponga, Sabang South, and Maybacong will be randomly selected. The next step is to identify in the 5 barangays that were randomly selected those who meet the inclusion criteria of being 18 years and above, a resident of Borongan City, present in Borongan by the time of the study, an individual who has social media accounts like Facebook, Messenger, or email, because the questionnaire will be sent through these platforms, and an individual who is willing to be part of this study. And the final stage is to determine the study sample size, which is 53 respondents per barangay. So next slide, please. So a structured questionnaire or survey form will be developed for this study. The research instrument will consist of the following major parts: the socio-demographic profile, health practices, vaccine-related data, under which is willingness, and also the preferred brand. And lastly, the participants' sources of information regarding COVID-19. The list of this general adult population will be taken from the barangays, and the researcher will ensure that the data gathered is updated and correct. And the target respondents who qualify the inclusion and exclusion criteria will be given consent form, and then a link of the questionnaire through social media platforms. And the collected data will be collated and analyzed utilizing appropriate statistical tools. Thank you. That's all for my research proposal.
Thank you, Jaya, for the presentation. So now let's move on to Desiree Joy,
Doon tayo sa communities nila.
who's coming up next.
Good afternoon, Doc. Good afternoon, everyone. So
Good afternoon.
this is my research proposal, a comparative study on the trends of the surveillance of the notifiable diseases in Caloomalok, South Cotabato in 2017 to 2022. So this study compares the 5-year trend of the most common notifiable diseases, syndromes, or conditions in the Caloomalok, South Cotabato report in the surveillance systems. So disease surveillance is the cornerstone of public health decision-making and practice, and the surveillance data gathered will be utilized in prioritization, policy-making, and early detection of epidemics. So the initiation of the Philippine Integrated Disease Surveillance and Response, or the PIDSUR system, aimed to improve the current disease surveillance systems in the Philippines. The program envisions the integration of all surveillance and response activities at all levels. It will provide a more rational basis for decision-making and implementing public health interventions that effectively respond to priority diseases and events. So the priority diseases, syndromes, or conditions targeted for surveillance can be grouped as epidemic-prone disease target for eradication and elimination, and other diseases of public health importance. So among these notifiable diseases, dengue, influenza-like illnesses, typhoid fever, measles, and rabies are the most common reportable cases in the municipality of Caloomalok. So the local government unit immediately reports all available essential information such as the clinical description, laboratory results, number of human cases and deaths, sources, and type of risk to the next higher level is highly recommended. So a standard case definition for surveillance is a set of criteria used to determine if a person has a particular disease, syndrome, or condition, and if the case should be in reporting and investigation. So the objective of these studies to establish the 5-year trend of surveillance of
of typhoid fever, dengue, influenza-like illness, and rabies. To identify the factors affecting the surge or decline of the most common notifiable diseases in Caloomalok, South Cotabato. To differentiate the trend between the 5 most common notifiable diseases in Caloomalok, South Cotabato. Next, to correlate the surveillance data reported by the different reporting facilities and to evaluate the impact of SARS-CoV-2 pandemic on the reporting notifiable diseases. So back to the first slide page. So this study aims to evaluate the decline or surge of notifiable diseases and the impact of the SARS-CoV-2 within the year 2017 and 2022 to 2022. So a retrospective descriptive multi-year study design that utilizes all the surveillance data reported from January 2017 to December 2022 will be utilized. And it includes the population of the residents of Caloomalok who were diagnosed with notifiable diseases, namely the 5 most common reported diseases in the municipality. Next. So the variables of this study are the 5 notifiable diseases cases, the age group and sex of the reported cases, the reporting facilities within the province, and the year of reporting of the cases. And the possible data analysis is deemed appropriate when all the data are available. Thank you.
Thank you. Thanks, Joy, for the presentation. Let's now proceed to the next one. Whitney, are you the one presenting?
Kasi kung hindi crowdsourcing yung
Good afternoon po, Doc.
Yes, yeah, good afternoon.
Ray, pa-share ako ng screen.
Happy birthday pala, Whitney. Happy birthday daw.
Thank you po, Doc. So, my study is about Ficus dota or black cover as an evolving plant. And I was interested in this topic due to a week of that I have attended. So the background of the study is traditional practices have gained attention for the use of different plant species in the community. Medicinal plants have long been used since the prehistoric period. And in some places of Cordillera Administrative Region, mummification has been traditionally practiced. And fortunately, a mummification process reveals the use of smoke as a drying method, the use of herbs in the preservation of the dead, and was based on verbal accounts of elders who were able to hear stories from their ancestors. So in Bontoc Mountain Province, there is a plant used by old folks to embalm the dead body, which is locally called lablafay, which is shown in the picture. So the objectives of the study is to first is to determine the biologically active compounds of the plant Ficus nota, and second is to determine the antibacterial activities against the bacterial strains such as Escherichia coli and the Staphylococcus aureus. So under the methodology, there will be experimental procedures. First is we air dry the Ficus nota, ground the plant Ficus nota, and apply ethanolic extracts. And there will be antibacterial assay using agar well diffusion method. And lastly, the use of phytochemical screening of the extract. So my research design would be an experimental method. So the subject, lablafay plant, will undergo different laboratory experiments to answer the research objectives. The study will use the complete random design and Duncan's multiple range test. So that's all. Thank you.
Thank you, Whitney, and happy birthday again. Let's now move on to the next
you po, Doc.
presenter. I think we have Rhea May. Tama?
Lagi naman yung sinasabing kakausapin niya, tapos kalimutan niya.
Good afternoon, Doc. Good afternoon, everyone.
Good afternoon.
My research title is Local Health System Capacity and Hypertensive Patient Preference in the Use of Telemedicine as Healthcare Management in Rural Health Unit of Harro Leyte. For the background of the study, telemedicine as defined by the WHO is the delivery of healthcare services where distance is a critical factor by all healthcare professionals using information and communication technologies for the exchange of valid information for diagnosis, treatment, and prevention of disease and injuries, research and evaluation, and for the continuing education of healthcare providers in all interest of advancing the health of individuals and their communities. Based on the study, it is proven that telemedicine is proven to be practical and convenient. And aside from this, telemedicine has shown a promising result in increased access to healthcare and could be one of the solutions in health inequities. So last May 19, 2021, the DOH, DILG, and PhilHealth has released a Joint Administrative Order number 2021-001 entitled Guidelines on the Implementation of Telemedicine in the Delivery of Individual-Based Health Services. So this will be implemented within 1 year after 1 year of release of this Joint Administrative Order. So therefore, this research will be conducted to evaluate if the health system is capable and had enough resources to utilize the telemedicine in the delivery of health services. Also, as part of the study, the patient's preferences and perspective of healthcare workers will also be assessed. Statement of the problem: what kind of telemedicine services should an RHU provide? Does the local government unit and the rural health unit have enough resources to implement telemedicine? Would hypertensive patients prefer to use telemedicine in the delivery of healthcare services? What would be the perspective of the healthcare provider on the use of telemedicine for the delivery of healthcare services? For the objectives of this study, first is to identify the type of telemedicine services should an RHU provide and look at the patient's preferences and healthcare provider perspectives on the use of telemedicine for delivery of healthcare services. And lastly, to assess the rural health unit's capability in telemedicine as part of healthcare services. Study design: this study will use a qualitative approach using a focus group discussion among hypertensive patients and key informant interview among stakeholders of the health system, and a purposive sampling will be utilized among the participants. For the data collection, data will be collected using a semi-structured guide. A guide provided a loose structure within which to explore the topics of interest. The focus group and key informant interview session will be recorded and later will be transcribed. For the data analysis, this study will utilize thematic analysis using inductive approach. That's all. Thank you, Doc.
Thank you very much for the presentation. I think that's the last presentation for this afternoon since Saname is still currently having her health problem. He has requested deferment of her presentation this afternoon. So thank you for coming today for your presentations and working hard on your proposals. So just to have a very brief general comments on what we have seen. So first of all, congratulations for a good job, well done. So despite the very short time period for preparation, generally I could say that most of you performed better than expected in terms of the quality of work that you presented this afternoon. So I'm impressed with the creativity and the depth of your proposals, given the limitations that we have during the past few weeks. So congratulations once again for the work that you're able to do. So I have just a few comments. First is that I think in general, the topics that you have presented are interesting public health problems that we should do more research on, and I would encourage you to really pursue these research proposals and develop them into a possible thesis topic for your final year paper. But in terms of the methodology and in terms of the design, in terms of the population sampling, I think most of you have done your work and you have done your appropriate research. And in terms of, I think what we need to work more will be in terms of the conceptual frameworks and the literature review. What are the established papers in the field that are out there and put them in the paper. But since this is just a capsule proposal, we don't expect that everything will be there. So I think one of the things that I could suggest is that in terms of presentation, those who presented a lot of text in the PowerPoints would do well to take a look at your other classmates' presentation, or did a lot of graphics. So I enjoyed the presentations which have more graphics to them, and the way you have creatively arranged your concepts so that you don't need to put all the words in the slide. In fact, the suggestion is that you don't put in more than 7 lines of text in a slide in a PowerPoint presentation. So in terms of presentation wise, most of you did follow those rules and were creative in terms of presenting their ideas. And for those of you who need to improve in it, you could actually take a look at your classmates. Anyway, we will be uploading this video recording for a certain period of time in the Canvas website, so that some of the faculty who would like also to check on the presentation and the research proposals can take a look at your proposals and see which ones they would be interested on, hopefully to develop together with you as a proposal in final year. So we have not yet decided how we will be assigning the final year thesis topics in terms of the faculty, but since not one will hindi kaya na isa lang mag-advise, so all of us faculty members will be taking on some advisory role in your research proposals. So hopefully in the next few months, as you go to your rotations in clinical rotations, you'll continue to think about these topics that you have presented and do more research, do more literature reviews, and do more readings, so that you'll be prepared to have a more comprehensive, robust proposal when the time comes. So the good news is that next year, hopefully we'll be having 2 more faculty members joining the department. So we will have Dr. Romel Capongcol, surgeon, who's coming in, and also Dr. Another alumna of SHS coming in as a graduate of internal medicine program in EVR. So there will be 2 full-time members coming in and some more part-timers. So there will be more people who hopefully will be able to help you when the time comes for your community internship. So I will be putting on more comments to your proposals in the next few days. Hopefully it will be up for a few more weeks so that you will have time to digest the suggestions. So just a final reminder, aside from this presentation, one of your final requirement for this course will be finishing the good clinical practice workshop, the one in NEDA. So if you have not finished it yet, please do so. Finish it as soon as possible. Of course, next week, finals week, so I don't expect you to do the work then. But after the next week, you could probably take some time to finish it. Anytime you are able to finish it, you upload it to the portion that we have allocated for it in the website. So I will be uploading a file I'll be uploading an assignment section for the GCP certificate, for the Good Clinical Practice certificate tonight. Some of you already submitted to me by email and by the GCP certificate. Congratulations for finishing it. So job well done. For those of you who have not yet finished it and still working it, please do so in the next few days and the next few weeks. So hopefully submit it in the next 2 to 3 weeks if you can into the website page that in the assignment page that I will be uploading in week number 10, in week 10. So that will be, for my part, that will be the final requirement aside from the final this presentation that we give to. So thank you, TJ, for facilitating the class, engaging with your classmates how to organize the presentation. Good job, everyone. And let's continue to pray for Sana May as she and the family recovers from COVID-19 pandemic. So any concern at this time that you would like to share or to ask? TJ, you have a question?
May isa pa bang project ni Marvin?
And po, Doc.
Okay. So Nan, let's take a picture for your class picture of our research presentation, research proposal presentation. So you can turn on your camera. Tapos kakanta tayo ng happy birthday kay tumatanggap kami ng Food Panda delivery dito. Meron kaming Food Panda. Meron na kaming Grab food. So if you want to just kidding. joke lang baka pressure ka. So okay, let's turn on your
Handaan
videos.
sa kanila, Doc.
Doon sa inyo yung handaan. Ang layo naman papunta namin. All right, so pictures please. Ready? Saan yung iba? Si Charmaine. So how old are you, Whitney? If I may ask, are you 21?
27 po, Doc.
27. Wow, congratulations. Yay.
Nasa kalendaryo pa po.
3 years lang palagap. 3 years lang palagap natin, Whitney.
Ay, wow.
All right. Let's say 1, 2, 3, smile. Happy birthday. Congratulations,
Thank you,
everyone.
Doc.
Good job. Okay.
Thank you,
Okay, keep
Doc.
safe. Keep in touch. Bye-bye.
Thank you, Doc.
Doc.
Thank you, Doc.
Thank you, guys.